Hey there, and welcome to This Explainer. I am absolutely thrilled you're tuning in. Today, we're going to dive into the four foundational concepts that honestly make every single complex disease process finally, perfectly make sense. If you've ever felt completely overwhelmed by the sheer volume of symptoms and conditions out there, take a deep breath. We are not doing rote memorization today. Instead, we're building a conceptual framework. Because once these core ideas truly click for you, well, everything from heart failure to sepsis just becomes a manageable variation on a theme you already know. Think about it like this. Long before an organ actually fails, or before any systemic symptom even appears, the whole process starts microscopically. Every disease at its very root begins at the level of the cell, and that is exactly where our logical journey kicks off today. So here's our roadmap for this explainer. We're going to hit cell injury and adaptation, then inflammation and tissue healing, move into fluid balance, tackle acid-base balance, and wrap it all up with a quick summary. Master these, and you've basically got the blueprint for virtually every pathology out there. All right, let's jump right into part one, cell injury and adaptation. This is honestly one of the most elegant ideas we're going to cover. A cell doesn't just immediately give up and die the second it gets stressed out by low oxygen or a toxin. No way. It puts up a real fight. It tries to adapt and survive. There are actually four classic structural changes a cell can make to handle that increased stress, and they're pretty fascinating. First up is atrophy. That's when a cell shrinks down to save energy, kind of like how a muscle shrinks when your arm is stuck in a cast for weeks. Then there's hypertrophy, where it grows physically larger. Think of a heart muscle getting thicker to pump against chronic high blood pressure. Third is hyperplasia, where the actual number of cells multiplies, which is exactly how the uterus expands during pregnancy. And fourth, we have metaplasia. This is wild. It's where a delicate cell is completely replaced by a tougher one, like how a smoker's airway builds a much thicker, tougher lining just to handle the constant irritation from the smoke. But, what happens if that stressor is just too severe, or maybe lasts way too long? The cell pushes past adaptation straight into injury, and if that injury crosses a certain threshold, the cell is going to die. But the absolute crucial point here is how it dies, because it takes one of two distinct paths. On one hand, you have necrosis. This is the messy, uncontrolled death. The cell swells up, ruptures, and just spills its contents everywhere, which sets off a massive inflammatory alarm in the body. We're talking heart attacks or severe burns. On the other hand, you have apoptosis. This cell is a polite little rule follower. It's programmed. It shrinks down neatly, gets quietly cleared away, and completely avoids setting off inflammation. That's just your normal, everyday, healthy tissue turnover. Which leads us perfectly into part two, inflammation and healing. Basically, organized tissue rescue. So a lot of people tend to view inflammation as the bad guy, right? But I want you to flip that perspective. It's actually a highly organized four-step rescue operation that paves the way for healing. The absolute second tissue is damaged. Boom, step one, mast cells release histamine. Step two, that histamine immediately dilates your blood vessels, bringing in redness and warmth, and makes them permeable so fluid leaks out, which causes the swelling. Step three, neutrophils rush to the scene within hours to aggressively fight off any infection. And finally, step four, macrophages roll in to clean up the microscopic debris and transition that whole site into the healing phase. Now, once that cleanup crew is done, healing takes one of two specific paths, depending on the wound type. This is a classic distinction you've got to have down. Primary intention is when the wound edges are clean and practically touching, like a surgical incision neatly closed with sutures. It's super fast and leaves minimal scarring. Secondary intention, though, happens when there's a lot of tissue missing, like a severe pressure ulcer. The wound literally has to be left open to heal from the bottom up. It takes way longer, and it leaves a much larger scar. But here is the massive clinical takeaway from all this. When that acute, helpful rescue operation we just talked about fails to shut off, it becomes chronic inflammation. It stops being helpful, and instead it becomes the primary driver of massive, systemic diseases. We're talking rheumatoid arthritis, atherosclerosis, type 2 diabetes. The inflammation becomes the root cause itself. All right, scaling up from tissues, let's hit part three, fluid balance and electrolytes. If you want to stop rote memorizing endless lists of clinical symptoms, you really just need a solid grip on this single concept. Osmosis. Honestly, think of this as unlocking a cheat code to pathophysiology. Your body's fluid lives in two main places, inside the cells and outside the cells in your bloodstream. Water just moves freely back and forth between these compartments through osmosis, constantly shifting toward whichever area has a higher solute concentration just to try and equalize everything. And sodium is basically the primary dictator of all this fluid movement. Take hypernatremia, that means you have high sodium in the blood. Well, that excess sodium acts like a magnet, pulling water out of your cells and causing them to shrink. And let me tell you, your brain cells absolutely despise shrinking. That's why this causes severe confusion and lethargy. Conversely, hyponatremia is low sodium in the blood. So the water rushes into the cells to equalize things, causing them to swell. And swelling inside the rigid, tight space of the human skull, that creates incredible pressure, leading to excruciating headaches and dangerous seizures. Once you get the mechanism, the symptoms make total perfect sense. Potassium, on the flip side, hangs out mostly inside the cells, and it governs something entirely different, the resting electrical rhythms of your heart. That is exactly why having too much potassium, hyperkalemia, is so incredibly dangerous. It totally disrupts that electrical baseline, leading to peaked T waves on an EKG, and, if nobody catches it, absolutely lethal cardiac dysrhythmias. Moving right along to part 4, acid-base balance. I know mastering pH is a topic that strikes fear into the hearts of many, but I promise it's beautifully logical once you decode it. Your body has to maintain an insanely tight, microscopic survival window for your blood pH, right between 7.35 and 7.45. If it drifts outside that tiny margin, cellular functions just immediately start shutting down. So to protect this window, your body uses two distinct systems that act like the ultimate tag team, the respiratory system and the renal system. Okay, if you remember nothing else from this section, memorize this master key. CO2 is acidic, and bicarbonate is basic. That's the whole framework. Your lungs are constantly regulating the acidic CO2 by just breathing it out, while your kidneys are down there managing the basic bicarbonate by either holding onto it or excreting it. So, what happens when one of those systems fails? You get one of 4 primary imbalances. Let's trace it out. On the respiratory side, respiratory acidosis happens when your lungs can't clear enough of that acidic CO2. Think of a COPD patient who's hypoventilating. CO2 builds up and the overall pH drops. Respiratory alkalosis is the exact opposite. A panic attack causes hyperventilation, you blow off way too much CO2, and the pH shoots up. Now for the metabolic side. Metabolic acidosis happens when that basic bicarbonate gets lost, maybe through severe diarrhea, sending the pH crashing down. And metabolic alkalosis, that's when acid is lost, like through prolonged vomiting, leaving you with too much basic bicarbonate pushing the pH up. But here is where it gets incredibly cool. The body doesn't just sit back and accept this imbalance. It fights back. It compensates. Think of your lungs and kidneys like a mismatched buddy cop duo. If the kidneys drop the ball, the fast-acting lungs will frantically adjust your breathing rate within mere minutes to try and fix the pH. But if the lungs are the ones failing, the kidneys step up to the plate. Now they're the slower partner, so it takes them hours, sometimes days, to carefully tweak those bicarbonate levels. But the point is, they are dynamically, constantly covering for each other's failures. And that brings us to part 5, our summary of the foundations. Let's just take a step back and appreciate this incredible physiological blueprint we've built together today. We scaled this up from the very bottom. We started with how microscopic cells adapt or die, and the massive difference between a messy or clean death. We explored how that specific cellular damage triggers a highly organized inflammatory rescue mission. Then we zoomed out to see how sodium drives massive systemic fluid shifts, and how potassium governs your heart's electricity. And finally, we just decoded the whole body acid-base chemistry tightly managed by the lungs and kidneys. So, knowing that literally every single pathology you're ever going to study is basically just a variation of these 4 pillars playing out in different organs, I want to leave you with a question. The next time you're reading about a failing organ or looking at a staggeringly complex disease, stop and ask yourself, which of these 4 foundations failed first? Figure that out, and you're not memorizing anymore. You are truly understanding. Thank you so much for hanging out with me for this explainer, and I really hope this helped all those pieces finally click into place for you.